Three. Hi, my name is Dr. Marcus Laubhammer, and I've got today Adam Hamilton with me, and we are trying to explore a subject called functional health. And Adam, he worked with this for about 13 years. And first of all, Adam, can you introduce yourself? What you're doing? How did you get to this concept?
Yeah, sure. Thanks for having me on, Marcus. So I'm Adam Hamilton, Operations Director at Healthcare RM. I used to be a semi-professional athlete. I was involved in skiing and then worked through different sports. And it was through being in sport and getting injured that I started to get trained myself in corrective exercise, preventive exercise as well, and then working on functional rehab programs. And then from there, I got involved in what's called becoming a Czech practitioner and looking at coaching and various different things to do with the National Association of Sports Medicine. And that was how over time I sort of brought together the concept of functional health and brought that all together. So that's where I'm currently at, is running the operations for Healthcare RM and bringing all these new concepts into place.
And we spoke beforehand about this a little bit. I mean, there's obviously functional medicine in medicine, but you came up with a functional health concept, and I think you wanted to explain us what is it.
Yeah, sure. So I mean, you're absolutely right. There's functional medicine, and the term functional health has been used within medicine itself, but the actual, what we're talking about here in terms of the functional health department we have, the functional health team, is looking at everything that makes up what makes somebody healthy or makes somebody functional. So whether that's from a physical point of view, a psychological, emotional point of view, or nutrition and sleep, flexibility, strength and conditioning. So we brought it all together and taking all of the learns of what is best and most effective, and then when assessing or treating or coaching someone, is applying what is important to them to help them become functional, that's relative to their life. So it's going to be very different between, say, an office worker who's in their 20s being functional is different to, say, maybe an engineer who's in their 60s and are trying to maintain pace with workloads and everything that they're doing, or somebody who's in their mid-40s. So functional to what the individual requires for their life and not just work purposes.
Yeah, should we go a bit more into those subgroups? You mentioned obviously exercise. That's probably one of your favorite subjects. How do you use this in functional health?
Yeah, so with the exercise side of things, I think a lot of the time, when we're talking about national or government guidelines towards exercise, people get, if I use the term, get turned off by it. Oh, I don't want to exercise. It sounds hard work. What does that mean to me? Or do I have to go and run a marathon or join a gym? So what we try and do is to take that word exercise and look at it in terms of physical activity and keeping people physically active and looking at, okay, what do they need to do to improve their overall health, prevent them from getting ill health and disease, so reducing their disease risks, but saying, okay, what do you do during the day? So are you office-based, are you field-based? What's your occupation? What do you do? And then finding what works best for them and what they enjoy doing, because the way that we look at it, in particular the way that I look at it, is it's not about doing a program for 12 weeks. It's not a fad type thing that we want somebody that, oh, you're going to be amazingly fit in 12 weeks. It's what they can sustain for life. So we're looking at longevity and quality of life, particularly if somebody's experiencing something now and they're only in their 30s, is we want to make sustainable lifestyle changes that works for them and their family and whoever else is involved within their social group, that they can sustain it for the rest of their life, and it helps with longevity and disease prevention in the future as well.
And these things you offer in a gym, or they can do it at home, or how does this work usually?
Yeah, so we work with people individually as to see what works best for them. So if somebody So we can do it all telephone based through video calls, Zoom, Teams calls, that sort of thing. We do go on site as well for clients as well to see people face to face. But the whole idea of it is doing what works for the individual. So if somebody doesn't want to go to a gym, we're not going to give them programs, recommendations that involve a gym. If somebody, let's say they're an avid walker and they love to walk their dog, we'll make everything to do with that program around their likes, what's going to work for them. If somebody, is a runner, or let's say they enjoy yoga, whatever it is, we'll always take those things that they're keen interests and use that to help improve their health and their lifestyle.
Okay. And when we come to lifestyle factors, you also mentioned nutrition.
Yeah.
How does this look? How does this fit into the functional health sphere?
Yeah, so with nutrition, it's a very similar thing. It's not about saying to people, you have to be on this diet, you have to eat these foods and eliminate that. We're looking at, so okay, what's the person got wrong with them? What's the complaints, the ailments they have? And then looking at what do they currently eat? Where are there any quick wins in terms of improving their nutrition? The nutritionists that we work with and those that, within the team always talk about improving their nutritional habits or their eating habits rather than saying diet, because we don't want to put someone on a diet again, because if we look at what happens within, industry, in the media, diets are just trends that last for a short period of time and people go off and on. And of course, this just becomes this yo-yo cycle. So we use that to say if somebody's got, let's say, psoriasis, eczema, IBS, Crohn's, anything that, that's got some serious sort of digestive or nutritional influence to it, then we'll look at that and say, okay, are there any trigger foods that you're having that we can reduce, eliminate, but this needs to be sustainable for life, because we don't want to put someone on a super strict program that they can only do for a couple of weeks or a month, and then they fall off that program and they go back to, the previous habits, because that way we haven't addressed the root cause. And also with the nutritional side of things is the same with all of the areas actually within functional health, is it's educating people so they can make informed choices. So they know that if there are certain foods, certain lifestyle choices they're making that are making their health worse. So let's say if they've got something like eczema or IBS or Crohn's or something, there's certain things that are flaring that up and making it worse. They then have the informed choice as to, okay, maybe I shouldn't do these things, I shouldn't eat these foods as much, I should reduce it, to then help themselves move forward, which then works into more proactive management, because some of these people will be under the care of a specialist as well, because they may need to be on a medication. But there is more of a proactive management of that, combining in the lifestyle risk factors. And then that can help reduce further flare-ups in the future and prevent things from getting worse and be a better long-term plan for them.
So you also use it to actually help them with their doctors to get better in what they have, not only to look at overweight, obesity issues.
Yeah, exactly. Because I mean, you take obesity, diabetes, high blood pressure, anything. There are going to be a population of individuals that will need medication to help control that. But unless you get to the underlying root cause of what is causing that and changing and making some more healthy habits for that individual, then the medication they're on is only going to be so effective. It's not going to be fully effective. And what we tend to see is when we combine that with the adjustments, and we're talking small adjustments for people at times to start seeing some good significant return on these changes, that then the medication they're on is more effective. They tend to get reviewed by their GP or their specialist, and they bring down the amount of medication they're on, which again, that has a better effect for them as well, because we know that a lot of medications that people go on, there's side effects or contraindications to them as well. So if people end up on multiple medications, it can be quite stressful for the individuals as well. So by helping them make these changes within their lifestyle, then has sort of a secondary and sort of tertiary impact that you wouldn't expect to start with. Because you think, oh, it's someone on diabetes, someone with diabetes, And then we start doing, you could kind of say that the obvious things, but they become so ingrained into making a difference in their lifestyle that their diabetic medication, whichever one they may be on, starts to get reduced, and they have overall improvements in their health. And of course, they're then preventing further risk factors that can be associated with diabetes if it becomes unmanaged further down the line.
And I think the third concept of your functional health is psychology or emotional well-being. How do you manage this, or how does this fit in this concept?
Yeah, so the psychology and the emotional well-being side, again, it's looking at the individual based on what they're presenting with, because if you're looking at psychological health, emotional well-being, you've got so many different factors in there, whether we're talking about someone's resilience, if somebody's got a form of anxiety, because there's obviously different types of anxiety, low mood, if we want to call it quote unquote stress, is we then make sure that person is getting the right type of help, support, whether that goes into personal coaching, whether it's executive coaching, whether it's, signposting to some self-help material, doing guided self-help. We've got multiple tools we can use is to get to, understand what is causing it, and again, when you look at the psychology of an individual and you look at what they're presenting with, it will never just be like any one of these things. It will never just be psychology on its own. It will have a multitude of things that are linked to it. So we try to look at that and say, okay, what's going to be the best thing that's going to help that individual overcome? So if it's anxiety, for instance, is we will look at everything as a whole as to say, what's going to be the best psychological support to deal with that anxiety, but then what else should we look at as well? And that's where sort of this concept and method and the way that the team works and integrates has been so powerful. As it takes a lot of time and research and development to get that right and to understand how best to treat and support individuals.
So are these then the three main pillars, would you say, looking at an individual, looking at their exercise regime and strength, looking at their nutrition, and then looking at their psychology? Is there anything else you would say fits into functional health?
There's, definitely, I would say from that as well is the sleep side of things. So looking at the sleep that people are getting, because we know that in sort of today's ways of working lifestyle, things like the pandemic and everything, change of routine, that has had an influence on people's sleep. And as we all know, sleep has a huge impact on your overall health. So that's another thing that, again, we have to work with what people can and can't do, what's within their control. If someone's a shift worker, we can just give them advice. You can't say stop doing shift work unless they really want to stop doing shift work. But if somebody's got a newborn child, is okay, how can they develop a better sleeping, call it sleep hygiene, to make some small improvements on on their health and improve their sleep, so that impacts it, because if we get poor sleep, tends to have an impact on our nutrition. We start to make different nutrition choices because we feel excessively tired, so we'll tend to lean towards sugary foods, high caffeinated drinks. Then physically it has an impact, and then psychologically it has an impact as well. So sleep kind of ties everything together, but again, on the flip side, you have to look at everything else as well to make sure that the sleep quality can be improved, not just quantity, because everyone thinks, oh, more sleep must be better, but it's actually quality of sleep.
Yeah, and I think we spoke before as well. You work in a team, so you're basically functional health is delivered as a functional health team, and I think you wanted to explain how this works and how this all comes together.
Yeah, so the way that the team kind of works is that we've, over the years of research and things that I've learned that's effective and not effective within different teams and different dynamics of doing different things, whether it's been within functional rehab programs, is how best to build that and bring the right people together. And then by working collectively as a team and integrating all of the different specialists, we then have ways that we're able to assess case by case basis. We've got various tools that we use in terms of assessing people and running algorithms to then bring it together, as to say, okay, what's most important with this person? So if we were assessing you, we'd say, okay, what's most important to Marcus? What's going on here? What do we need to address? Who needs to be involved first? Do we need more than one person? And then once we've done those kind of initial assessments and those initial, it could be coaching sessions, as we say, okay, Marcus is at the age now where he might need to move on to a nutritionist, or need to move on to someone who can give support on sleep, or, we might have to link in with your GP. So there's, depending on the case that comes in, depends on who within the team gets involved. If it's a very, very complex case, they might have, 4, 5, 6 people that get involved at some point. They might not get involved directly with the individual, because they might just be getting involved from a background point of view as to review the individual's case and provide some support as well. Or they might just do, one session with the individual. It's completely bespoke and tailored onto what the person is presenting with.
And who do we have as team members? Physiotherapists, nutritionists?
Yes, so we've got physiotherapists, nutritionists, naturopathic doctor, sports therapists, sports and exercise coaches, strength and conditioning coaches, CHEK practitioners, executive coaches, lifestyle coaches. There's a whole host of people. Which
you draw then depending on the needs of the person. Yeah.
Absolutely, absolutely. And off the data that we collect in terms of who we're seeing and the types of cases that we get in and the types of people we deal with, we then look at what skill sets we might need additionally. So if something comes in and we go, actually, we need somebody who specializes in, let's say, cardiology, for instance, we would look at, have we got someone that we could resource in with that? Have we got a trusted provider we could use that could provide some support? So it's all very individual based. And of course, if we haven't got the skill set within the team, we look at, have we got trusted people with, trusted providers or network that would link in, that would be part of that kind of holistic view and approach to things. And
I think what might be a good thing is to do a little case study. In a way, you have a 52-year-old office worker who basically has on and off some back pain, and now it has been getting worse. Is maybe about 85 kilograms, married, 2 children who are teenagers. How do you approach this?
So I think the first thing with that individual is, when we have the first assessment with them, is understanding what's their needs and what are their goals, what is most important to them. And I think this is a big thing that gets used within functional rehab programs anyway, is because we don't want to go straight into that individual and say, oh, I understand you've got back pain, we're going to sort you out with physiotherapy, sort that back pain out. Because to that individual, them being functionally healthy might not be their back pain issue. It might be everything else that's associated with that. Oh, I can't do the things that I used to do. I've got no energy. I've got poor sleep. I feel like I've gained weight. I'm getting headaches, whatever it might be. So it's really getting a sort of a needs analysis from the individual, doing goal setting with them and saying, okay, well, this is the plan. This is what we can do. This is what we can work on. And then we look at things in terms of, well, who's within their social group as well, because that's the important thing is with a lot of this is you have to get the other members of their social group involved in the support and the changes, because if they're trying to make a significant change and the rest of the people in their social group, whether that's kids, wife, partner, family, are unsupportive, it's going to be much more difficult. Whereas if we say to them, we take this individual, their kids and their partner are like, yeah, we're fully on board. So what's the things that we need to change? Okay, we need to be more active. We get back from work or do stuff together on a weekend, maybe make some changes in nutrition, have a better sleep hygiene, routine. So it might be, for instance, let's say this person's also, when we start assessing them, they're struggling with their sleep patterns, ability to fall asleep. And it's looking at, okay, well, what do they do? They're using screens, like they're on their iPad, tablet, smartphone right before bed, staring at screens all day. And that's then having an impact on their circadian rhythm and their sleep. We'd then say, okay, well, here's some alternative options that you could try. If it comes out that part of what they're doing at work, they're not able to switch off when they come home from work, how they're carrying themselves, posture. So we look at all those sort of things as well and say, okay, how does that sound to you? And also, what do they feel is contributing? So again, it's that coaching methodology of saying, okay, where do you want to get to, and what do you think has led you to where you are now? Because there's no point in running sessions as sort of like dictating to people, well, you need to do this, this, and this. You need to lose weight. You need to do that. You need to do that. People just won't engage, and they'll be like, oh, I'm not interested. Whereas if we can coach and help people understand and find stuff that is, if I say really easy for them to do, I mean that in the sense of setting goals that seem so easy to achieve that people go, well, what's the point? And I go, well, if you don't do it. So from my point of view, if I'm coaching someone, if you set a goal really, really high and somebody misses that goal and they hit lower, they get demotivated and they think, oh, see, I can't do it. If you set really small incremental goals, let's say with the back pain, let's say this person, it is for them back pain. And they say, okay, when does your back pain affect you most? And what sort of things are limiting? So then we set a really small goal. And if it's simple things of doing, let's say it's appropriate for this person to do some mobility exercises. So, okay, I just want you to do 1 minute of this mobility exercise every day, just 1 minute, no more than a minute. And then they'll say, okay, well, that doesn't seem a lot. I'm like, yes, but you're doing 0 minutes of it now, 1 minute every single day. That's 7 minutes in a week, 365 minutes in a year. That adds up over time. And of course, they start doing 1 minute and then they go, okay, well, that's easy. I can easily do that. Okay, do you think you could do 2 minutes? And then again, it builds. And it's the same if they had to make nutritional choices, or, it's these small marginal gains that, again, as we're saying, add up over a lifetime. So if it's sugar as well, it's another one that's a good, let's say the weight gain's actually coming through. Diet's pretty decent, the nutrition, what they're eating is pretty decent, but they're having 7 cups of coffee a day and they're having 4 teaspoons of sugar in each coffee. That's a lot of sugar throughout the day. So you just start by saying just one of those cups, reduce your sugar by, just half a teaspoon less. It seems insignificant until you do the maths on it and add it up over a year, the next 10, 15, 20 years. And of course, if you slowly start reducing that sugar intake and they make no other changes, it will have an overall impact on improvement to health. They're ingesting less sugar, they get better blood sugar regulation, it improves their sleep, they start losing weight. And so it's like a kinetic effect. It has this chain reaction. And that's where, for say this individual, that's where we look at things and we, start to see, is there anything else that's having an impact? What else do we want to work on? So rather than, doing it in bits, or we'll do the back pain and then we'll do this and we'll do the other, and it being sort of, you treat someone for one thing or coach them for one thing and they go away and then they come back with something else. As we try and do it all together at once. So what you tend to find is everything's integrated, because we all live within one body. Our mind is in our body, everything's within one body. So we have to kind of treat the person holistically and look at everything as one.
Yeah. And I think you're also quite passionate about then the long term of this person you see. And I think what you say in your functional health proposal is also finding the non-clinical root of their illness, in a way, making better lifestyle choices. And you said you integrate this while you see these people. Yeah.
Yeah, absolutely. For me, I'm super passionate about somebody's, let's say somebody's suffering with a disease, an illness, an ailment or something, but what can we do to proactively manage it? How can we reduce the risk of it happening again, or the severity of it and the flare-ups of it? And then how do we prevent it? And then how do we get that out to, other members of their family, their social group, so they can take proactive and preventative measures that are easily achievable to help them in the future, because prevention is far greater than a cure and easier to do. I use loads of different analogies with people. It's like doing the dishes. If you do the dishes whilst they're there, you put them in the dishwasher, or you wash them up one at a time whilst you've got them there. It's so much easier than if you leave them to just stack up on the side of the sink and then you've got to do them all at once. So if we can make the same lifestyle choices and changes that makes it easy and just part of day-to-day living, then it's sustainable and it doesn't seem like a burden, which is why I'm so passionate about trying to move people away from using, exercise routines or diets because they've got a stigma to them that's quite negative for a large majority of people. They go, I don't want to do that. Whereas you go, okay, well, we're going to just help improve your lifestyle and your quality of life by making changes that will just fit in seamlessly into what you're doing day to day. Then that seems to be much more effective with people long term.
I think that's good summary about it all. I think we spoke about what functional health is for you, and you developed it. Is there anything else you think people should know about functional health?
I think in terms of it's looking at things differently from it's not a medicinal approach to things, it's a non-medicinal approach. And we're always trying to integrate with, the medical and the non-medical, looking at the lifestyle related stuff. And I think if anything has been like sort of proof in the pudding over the last sort of couple of years, in particular with COVID and the pandemic, is it's been showing how important personal health and functional health is in every sense of the word, whether it's mental health, physical health, nutrition. We've seen that through the pandemic, whether it's been people have been at higher risk, lower risk. What has benefited people during lockdowns is getting outside, doing activity. People have just gone out and walked and been out in sunshine, and well, when we do have sunshine in the UK, and they've been doing more things together as a social group as well. We've seen the impacts of isolation and loneliness. So we know how that's had an impact on mental health, which has kind of reinforced the importance of looking after mental health and the things that can be done, and simple things like socializing, talking to friends, family, discussing things that could be bothering you. They have a huge impact in terms of managing that, rather than, if I say suffering alone and then it getting to a point where you feel like you can't cope anymore. It's the same with, lack of activity, etc. So it's a really kind of important thing. I'd say that functional health is so important to link in and use it as a preventative way to help reduce, long-term risks and issues for people.
I think that sounds like a very good finishing. Adam, I thank you for your time, and thank you.
Thank you.